A wound opens on the inside of the uterus, 8.5 inches across, the size of a dinner plate. Raw, open, bleeding. No one sees it. No one stitches it. It is the largest open wound most people will ever carry, and the body closes it fully, on 90-minute sleep cycles, while making food from scratch. That is not a metaphor. That is the literal biological event of the 6 weeks after birth. Hour by hour, the body takes apart what it spent 9 months building. Almost every system reverses. Almost. One thing doesn't, and we'll get to it at the end. That is the one fact worth staying for. If this kind of precise, honest body science is what you came for, subscribe to the channel. This is what we do. Hour 1. The placenta has just left the body. That departure is the starting gun for almost everything that follows. The baby made the wound. The baby closes it. Here is how that works. When a newborn suckles, the body releases oxytocin, a hormone that tells the uterus to squeeze. Those squeezes clamp the open blood vessels at the placental site shut. The baby's feeding is the compression bandage on its own wound. That is not a coincidence. That is a loop built in. It is also why after pains hit hardest during feeding. The uterus is squeezing hard. And it is why after pains are stronger with each later birth. The uterus has done this before. It squeezes harder. The loop runs faster. Hour 6. The hormone crash has already begun. During pregnancy, 2 hormones ran the show, estrogen and progesterone. Both were high. Both drop the moment the placenta leaves. But the speed of that drop is the thing. Estrogen and progesterone fall further and faster in the 72 hours after birth than at any other moment in the body's life. Progesterone is back at pre-pregnancy levels within about 3 days. Nothing in the body moves that fast under normal conditions. And from that one cause, that single hormonal cliff, come 2 separate effects. First effect, milk. Progesterone had been holding milk production back the whole pregnancy. The moment the placenta leaves, that brake releases. Prolactin, the hormone that drives milk production, runs free. Milk comes in on day 2 to 5. That timing is not random. The body was waiting for the placenta to go. Here is how closely it was waiting. If a piece of placenta stays behind after birth, milk does not come in. The body will not start until it is sure the pregnancy has ended. It checks, then it goes. Second effect, mood. Up to 80% of women experience the baby blues. They start around day 3, they peak around day 5. They usually lift within 2 weeks. Tearfulness, anxiety, a feeling that doesn't match the moment. This is a hormone withdrawal event. It has a clear physical cause and a predictable timeline. Postpartum depression is different. It affects about 1 in 8 women. It lasts longer. It runs deeper. It is a medical condition, not a mood, not a phase, not a failure. It responds to treatment. If the blues don't lift by 2 weeks, that is worth telling a doctor or midwife. Not because something went wrong, because there is a name for it, a course of care, and it works. Those are 2 distinct things. Knowing which one you are in matters. Day 3. The uterus is still squeezing, the wound is still closing, and the body has just started its second enormous task. Offloading the extra blood it built. During pregnancy, blood volume goes up by about 50%. The body needed that volume, the baby needed that volume. Now it doesn't. So the body begins taking it apart. And it does this through 2 routes that catch most people completely off guard. Route 1, bathroom trips. In the first week, the body can push out up to 3 quarts of fluid a day through urine alone. Up to 2 quarts of extra water go in the first week. Over the full 6 weeks, the total fluid lost can reach 2 gallons. That is a lot of trips to the bathroom. That is on purpose. Route 2, sweat. In the first few nights, the body dumps fluid through the skin while sleeping. Drenching night sweats, soaked sheets. Most women are not warned about this. They wake up alarmed. There is nothing wrong. The body is using every exit it has. The sweats are the extra blood volume leaving through the skin. They taper off as the extra fluid clears, usually within the first week or 2. This is one of the most useful things to know going in. It is also one of the least mentioned. If you're finding this useful, kindly hit the like button. We cover exactly this kind of thing. Day 4. The lochia has begun. Lochia is the discharge from the healing wound inside the uterus. It is visible proof of the repair in progress. Bright red for the first few days. Fresh blood and tissue from the wound site. Then it fades. Pink by the end of week 1. Pale yellow or white by week 3 or 4. The color change is the healing timeline, made visible. If it goes back to bright red after fading, that is a signal to pay attention. It can mean the body is doing too much too soon. But there is something else happening at the womb site that most people never hear about. The uterine lining is not simply sealing over like a scab on skin. It is growing back from the inside out. New uterine lining tissue is spreading back across the raw surface of the placental site, while the rest of the wound is still actively bleeding. Two processes, repair and regrowth, running at the same time, in the same organ, on overlapping timelines. By day 10, the non-placental parts of the uterine lining have already grown back. The placental site itself takes longer, up to 6 weeks. The body tackles the larger wound last, because it is handling the smaller ones first. Week 1, the uterus itself. At birth, the uterus weighs about 2.2 pounds. By the end of week 1, it weighs roughly half that. By 6 weeks, it is down to about 2 ounces. That is an organ shrinking to roughly a tenth of its birth weight in 6 weeks. No other adult organ does this, not even close. And here is how it does it, because the process is extraordinary. The uterus does not shed cells the way a wound sheds dead tissue. Each individual muscle cell breaks down and digests its own extra protein. Each cell eats its own extra bulk. That process, where a cell takes apart its own parts for fuel, is called autophagy. The uterus runs it at a scale and speed that has no match anywhere else in the adult body. 2.2 pounds to 2 ounces. 6 weeks. No surgery, no drugs. The body just does it. Week 2. The structural work slows down, but it doesn't stop. During pregnancy, a hormone called relaxin loosened the ligaments throughout the body. It had to. The pelvis needed to flex, the joints needed room. Relaxin doesn't clear the moment the baby arrives. It lingers. Joints stay loose well past the 6-week mark. The ankles, the knees, the wrists, all running on ligaments that are still softer than they were before pregnancy. This matters for exercise, for lifting, for any load-bearing activity. The structural scaffolding is still finding its way back. And here is the detail that tends to land hardest, because it is small and specific, and almost nobody mentions it. In 2013, a team at the University of Iowa tracked women's feet through pregnancy and then 5 months after birth. They measured arch height and foot length. In 60 to 70% of the women, the arch dropped and the foot grew by up to 0.4 of an inch. For many women, that is half a shoe size, and it does not come back. The relaxin-driven changes in the foot are permanent. The foot that comes out of pregnancy is not the same foot that went in, not a short-term side effect, a lasting structural change. The same relaxin that reshapes the foot also affects the rib cage. During pregnancy, the ribs flare outward to make room for the growing uterus and the upward push on the diaphragm. The circumference of the rib cage can increase by 2 to 3 inches. For most women, the ribs gradually return toward their original position after birth, but not always fully and not quickly. Some women find that bras and fitted clothing that fit before pregnancy no longer fit correctly, even after the belly weight is gone. The rib cage itself has changed shape. This is not a weight issue. It is a structural one, driven by the same hormone that changed the foot. That is one small permanent change. There is a larger one still ahead. Weeks 2 to 4 also bring the slow knitting of the abdominal wall. During pregnancy, the uterus pushed the 2 halves of the abdominal muscles apart. The band of connective tissue running down the middle of the abdomen stretched to make room. After birth, that band has to close. In some women, it does not close fully on its own. The result is a gap down the center of the abdominal wall. The muscles are not weak, they are separated. That is a different problem. Weak muscles respond to standard core exercises. A separated abdominal wall can be made worse by the wrong exercises. Knowing the difference is the fix. The pelvic floor is doing its own separate rebuilding during this same window. The pelvic floor is a hammock of muscle and connective tissue that held the weight of the pregnancy for 9 months. During a vaginal birth, those muscles stretch to several times their resting length, further than any other skeletal muscle in the body is built to stretch. The nerve that runs through the pelvic floor can be squeezed or stretched during birth, which means the muscles may not receive full nerve signals for weeks or months afterward. The muscle is there. The signal is delayed. This is why pelvic floor recovery is not simply a matter of doing exercises right away. The tissue has to heal before it can be effectively trained. A pelvic floor physiotherapist can assess what is actually happening, because the gap between what a woman feels and what is structurally going on can be significant. At 3 months, something happens that has nothing to do with recovery and everything to do with the pregnancy that ended. We'll get there. Week 5. The 6-week checkup is approaching, and it is worth being clear about what it actually measures. The checkup exists to confirm 2 things. The placental wound has closed, and the uterus has returned to its pre-pregnancy size. Both of those are genuinely meaningful. Both are real physical milestones. The wound that opened at 8.5 inches across is closed. The organ that weighed 2.2 pounds is back to 2 ounces. Those are remarkable facts, and the checkup catches them. But the word cleared, the way it gets used in everyday life, implies a finish line. It isn't one. At 6 weeks, the pelvic floor is still rebuilding. The abdominal wall is still knitting. Joint stability is still recovering. Sleep debt is building, not clearing. Some of these processes run for a year. The number 6 is a clinical checkpoint. It became a cultural endpoint somewhere along the way. Those are not the same thing. Week 6. 2 markers confirmed. Everything else still in motion. Now, the payoff. Around month 3 to 4, something catches almost everyone off guard. Hair starts coming out in handfuls, in the shower drain, on the pillow, clumps on the hairbrush. It can look alarming. It is not hair loss. Here is what it actually is. During pregnancy, the hormones held hair follicles in their growth phase far longer than normal. Almost nothing shed for months. The hair got thicker, fuller, longer. Then the hormones dropped. The follicles that had been held in place all moved into the shedding phase together, not one by one the way they normally would, but in a wave. Month 3 to 4, the wave arrives. This is called telogen the fluvium, a wave of shedding where follicles that were held in place all let go at once. It is not a sign of recovery going wrong. It is the delayed bill for a pregnancy that already ended. The body is catching up on 9 months of normal shedding all at once. It resolves fully within 6 to 12 months. The follicles are intact, the hair comes back. This is not damage, it is a cue. The same hormonal shift that triggers the hair shedding also affects skin. During pregnancy, higher estrogen slowed the normal skin cell turnover cycle and often produced a visible glow, more blood flow to the surface, more held moisture, slower shedding of the outer skin layer. When estrogen drops, that effect reverses. Skin can become drier, more sensitive, and more prone to breakouts in the weeks and months after birth. Some women experience melasma, patches of darker pigmentation on the face that were triggered by pregnancy hormones and may take months to fade after birth. Others notice that skin that was clear during pregnancy becomes reactive afterward. These are not separate problems. They are the same hormonal reversal showing up in different tissues at different speeds. The same reversal reaches the eyes. During pregnancy, higher estrogen and progesterone increased fluid held throughout the body, including in the cornea. The cornea is the clear dome at the front of the eye, and it is sensitive to fluid changes. Its curve shifts slightly when fluid levels change. For some women, this meant their vision prescription changed during pregnancy. Contact lenses that fit before no longer fit correctly. After birth, as fluid levels drop, the cornea shifts back. Vision can fluctuate for weeks to months after delivery. This is why eye doctors typically recommend waiting until at least 3 months after birth and after breastfeeding ends before updating a glasses or contact lens prescription. The eye is still settling. The same fluid that soaked the sheets in week 1 was also, in a small way, sitting in the cornea. Now, the real payoff. The uterus reverted. 2.2 pounds back to 2 ounces. The blood reverted. 2 gallons of extra fluid, gone. The hormones reverted. Estrogen and progesterone back to baseline within days. The wound closed. The foot changed and stayed changed, but that is small, structural, on the outside. The brain did not revert. In 2016, neuroscientist Elseline Huxamer and her team published a study in the journal Nature Neuroscience. They scanned the brains of women before a first pregnancy and again after. They found reductions in grey matter volume, specifically in the regions the brain uses to read other people's minds. To model what another person is thinking, feeling, needing, without that person being able to tell you. The pattern was consistent enough that a computer, given only a brain scan, could identify who had been pregnant and who had not. 2 years after birth, the changes were still there. The framing here matters. Reduction is not damage. The study found no memory loss, no drop in thinking ability. The pattern looks like what happens in adolescence, when the brain trims connections it no longer needs, so the ones that remain run faster and more cleanly. Adolescent trimming is not a loss of brain function, it is a sharpening of it. The current best reading of the postpartum changes is the same, a brain being tuned. Tuned specifically toward reading a creature that cannot yet speak, cannot point, cannot say what it needs, a creature that communicates entirely through expression, cry, and movement. The regions that changed are the regions that do exactly that work. Huxamer's team went further. They found that the degree of grey matter change predicted the strength of maternal attachment. The women whose brains changed most showed the strongest responses when viewing images of their own infants. The structural change and the emotional bond were not separate outcomes. They were the same outcome, measured 2 different ways. The brain was not altered by accident. It was altered in the direction of the task. The brain did not lose something. It reorganized around a new priority, and it stayed that way. The wound is closed. The organ shrank, the blood drained, the hormone settled. Everything the body built, it took back down, on schedule, on its own, without help. Almost everything returned to where it was, except the part doing the returning, which had already changed into something else, and stayed that way.